Dr. Videau, thank you so much for joining us today.
Thank you.
Tell us a little bit about yourself and your experience as a cardiologist.
Well, I've been in Pensacola for 22 years. I've been here. This is my first and only job since graduating from Emory University, where I did internal medicine and cardiology fellowship. I'm in a large group in town, and I practice at most of the hospitals and have been taking care of patients here in Pensacola since that time, 1994.
Awesome. That's a long time.
Yes.
We want to talk today about women's health, specifically women's heart health. So what causes heart disease in women?
Well, the same thing that causes heart disease in men, and I think that we're blitzkrieged by media of the risk factors, but it's basically the same risk factors. Tobacco of any form, unfortunately, is a high risk factor. Having high glucose in your blood or diabetes, having an elevated level of certain types of fat or cholesterol in your blood are some of the major risk factors. Hypertension, which is very common in Americans. 1 in 3 Americans have hypertension, is a major risk factor. Some of the risk factors that are glanced over are stress, job-related stress, or it doesn't have to be just jobs. Stress in any form at home leads to heart disease. So does lack of sleep. Sleep is turning out to be extremely important for our bodies.
Interesting. Do women of all ethnicities share the same risk?
No, that's a very good question. Actually, studies have shown that African American women, Latin American women have a much higher risk. In fact, as much as 31% higher than Caucasian women. And there's a variety of reasons for that. Some of it's just lack of communication, language barrier. Some of it's education related. Some of it is environmental, different diets, different assumptions about health.
Now, you mentioned that the causes between men and women are largely the same, but I understand that while there's similarity between symptoms between men and women, there are some differences. So what are some of those differences?
Yeah, women can present just like a man with a heart attack, which I think most of your viewers will be used to seeing TV, where somebody's clutching their chest. But women have been labeled as having atypical symptoms. Atypical in that they're not always presenting like we think. It could be, women can present with jaw pain, elbow pain, simply lack of energy, shortness of breath, even abdominal pain. So I think the doctor of today needs to be cognizant of the fact that women can present differently than men.
So what are some things that women should really look out for? What are some warning signs that, okay, I need to take a look at my lifestyle and address this?
Yeah. I mean, I think women need to pay attention to their bodies. If the more active you are, the more you know your body. For instance, if you get up every morning and you walk a couple of miles, and you start noticing that you're getting more short of breath, or that your elbow's aching, your jaw's aching, these can be subtle signs that you should go see your physician.
So what does a heart-healthy lifestyle and diet really look like?
Right. We're all striving for that, aren't we? I'm just going to give you the general of what a heart-healthy overall advice is. One is diet. And remember, the word dietia is a Latin word that means a way of life. We don't want to diet. We want you to change the way you live. Mediterranean diet, many people have heard about it. It's simply using different food groups. Eating a diet that's higher in fish and legumes or vegetables. Trying to eat less red processed meat, which unfortunately here in this part of the country is very high. Processed meats have a lot of salt in them, so trying to avoid that. Eating nuts, olive oil. Eating healthy is one way to stay healthy. Number 2 is getting 6 to 8 hours of sleep a night. Can't stress how important that is. 3 is getting your blood pressure under control with medications if you have hypertension. There is things your doctor can do to check your cholesterol, and sometimes being on the so-called statin medicines all reduce your life. But a healthy lifestyle is sleeping, exercising, keeping active, and eating healthy foods.
And that's the same for men and women. I mean, that's just general good advice.
It is. There is no specific advice to women other than to pay attention to their bodies in a different way than men.
So if I'm at high risk for heart disease, or if I'm starting to see some of those warning signs that you talked about earlier, what's my first step? Sort of walk us through what a treatment plan for that would look like and what I should do.
Right. In today's world of media, it's amazing to me how many patients actually Google things, And that can be a little dangerous, but you know, if you don't feel like going to see somebody, Google your symptoms. The first thing is to have a primary care physician. Everybody should have a primary care physician simply because when you get in trouble, somebody you can call and go see, describe your symptoms. That doctor can call a cardiologist such as me, and we can get you in right away, or that doctor can order tests on you. Sometimes if your tests are kind of equivocal, they'll do a stress test on you. But the first thing you need to do is go see a healthcare professional and describe your symptoms if you're worried about them. You know, people sometimes get embarrassed that they're coming for nothing. We'd rather have you come for nothing than to wait too long. If you have symptoms that are accelerating and there's no doubt you're scared, you should go to an emergency room because you can get immediate care.
Gotcha. What are some of the resources that are available to people at Baptist Heart and Vascular Institute?
Well, I've been at Baptist Heart and Vascular now for my entire career. We now are up to 25 cardiologists. That's the size of a university. 3 heart surgeons. We have allied health professionals we've worked with for years, which are nurses, people that do your ultrasounds. You know, I always tell people it takes a village to take care of you, and it does. And Baptist has a Heart and Vascular Institute that can get you right in, do the appropriate test on you. If there's something we can't do here in Pensacola, which we can do a lot, we are associated now with the Mayo Clinic. I have a close association with Emory where I trained, University of Florida. We know where to go if we can't take care of it.
And I imagine that, not only Baptist will not only, solve the problem, like let's get this heart disease under control, but will also help you in the long term with that healthy lifestyle to make sure you don't come back in again.
No, you're exactly right. We're all focused on prevention now. Hospitals are incentivized to focus on prevention. We have seminars, we have talks just like this. We'd love for, we have a newsletter. It would be great for the public to be subscribed to that newsletter so they'll know when these seminars are.
Fantastic.
Yeah.
Well, thank you so much for coming in today.
Thank you for inviting me.
Dr. Videau, you've encouraged me to live a healthier lifestyle, and I hope our viewers as well, so thank you.
You look pretty healthy. Thanks.
Thank you.